Good afternoon. Today is October. Great. Today is August 19th, 2022. It's Friday. This is our weekly event with United Medical ACO, UMACO TV. My name is Kemal Erkan. I'm here with Sean Donovan. Sean, how are you doing?
I'm doing great. How are you?
Good. So we are gonna we have our some standard updates with new developments, and also we do have a guest speaker from United Medical. One of our client managers, Karen Morrison, is going to join us, and then we're going to discuss the global events, U.S. economy, and also the changes in the trauma services in the Newcastle County region.
Yep.
So we'll start with our COVID updates, and you're on.
Take it from there. Yep. So go ahead and kick it off with our COVID updates. Part of our COVID session here, we also do have our cartoon of the week. This one is referring to the inflation that's going on. So we see that it's Joe Biden there with he's saying that there's zero inflation in July, and then on the right hand side, it's come to the realization they're saying
sunglasses help him to see.
Covering up the shock in his eyes, but it says that's his latest poll number. So the point of this cartoon, obviously, is that inflation we know had skyrocketed. He was under the impression that July didn't increase any further, so he thought there's zero, and that obviously his poll numbers are not too favorable. If you're looking at the recent comparisons, it is going downward. So we just wanted to touch on that, with the fact that we will bring up inflation later on in our economy section. So that was relevant. Moving on to the COVID, we see the cases across the nation are actually declining a little bit. That plateau kind of peaked and now it's flattening out with a slight decrease. That is a good sign, obviously. As always, the symptoms and mortality rate associated with this COVID strand is not as fatal or not as serious and severe symptoms as that of previous variants.
But it's still impacting our day-to-day life.
Correct. Yes, it shouldn't be ignored for sure. But we just know the mortality rate and severity is a little bit better. And then our vaccination, we do have those graphics there showing you the numbers. As I said, state of Delaware seems to be increasing by around 0.1% of each of those age group categories. And then we also do have our monkeypox. Oh, before I get to the monkeypox, our COVID. There was the CDC releasing new guidelines for those who are around people who tested positive. So you'll see on our one slide, if you tested positive, the quarantine guidelines are still the same. But if you're around someone who,
if you're exposed,
exposed, you don't have to quarantine anymore. So we know that used to be if you were in contact with someone who tested positive, you would be quarantining yourself. But now they
although what may be happening, what's going to happen is things are going to change in a couple months. So as we are getting to the winter season, so all these things are going to be reversed, and they're going to tell us to do the exactly opposite. So I still tell people to take safe precautions. So then, good habits are helpful. I don't think it needs to be so strict, but there are ways to prevent these things to happen. Well, I cannot really talk from an example because I was one of the first COVID cases. So, but at least I can preach to other people what to do. So, I may not be a good example. So, but the thing is, again, learn what we have, what we experience, and see what can be done differently is kind of like important. I do really not want to rely on government telling us what to do. So if we are able to take our own precautious steps ahead of time, I think that's going to be the most efficient one for everyone.
Yeah, I mean, as you're saying, I think a lot of it may kind of fall under common sense where, if you're clearly sneezing, coughing, having fevers, you want to be.
But what do you know about common sense?
It's not that common.
Common sense is not common practice.
Exactly.
Right. So
we do have to remind people of these things. And then just the monkeypox update. So we are seeing an increase across the nation. So it's up over 14,000 cases across the U.S. as a whole. Delaware is still at 10 cases total. And with that death count, I believe it's around 12 or 15 of those deaths associated with monkeypox, none of which occurred in the US so far. So I believe they're in South America and Africa was where those deaths were occurring. And then regarding the monkeypox symptoms, as we mentioned last time, they are that similar of that of COVID. And a lot of the precautions that can be taken with COVID are the same and similar for monkeypox. And just for those that we know, monkeypox is a little bit different than COVID in regards to the testing. So COVID, we know, since it's been around for 2 years, we actually have the availability of take-home test kits that people can get sooner results and know if they're testing positive or negative sooner. But with monkeypox, it is still going to be a blood test that would be conducted. So if you're at your PCP and they suspect you may have symptoms of monkeypox and they want to just double check and get you tested, it would be a blood work test as a way to find out.
Very good. So I'm going to let Taryn in, and then we'll start with the RCM updates. Taryn, how are you doing? You're on mute.
How's it going, Kemal? I'm good.
Well, thank you for being with us. So this is your first time solo, right? So you were, you did actually join a couple of times, but I think it was with a group of people. Well, welcome back. So I know you're going to tell us about the some reporting process that we have at United Medical. But just before we start, if you can briefly introduce yourself, that would be great.
Sure. My name is Taryn Marson. I've been working as client manager for about 2 years now, or probably a little over 2 years. And I've been at UM for 7
years.
So, yeah.
All right, good to have you. So, all right, now the video is going to loop, and then we'll try to follow you and the video at the same time.
Okay, sounds good. Just as Kemal said, I'll be speaking more on the billing end of month reporting, also the client communication between our clients. So obviously communication between UM and the client is a key factor in how the client performs. Usually the correlation between the responsiveness of the client and how well their collection rates are on their services they provide usually correlates based on how well the client is communicating with us. The different ways that we communicate here at UM with our clients are through client meetings, whether it be monthly, weekly, bi-weekly, face-to-face or virtual, quick base, email, and obviously direct calls from the client if they have any requests. At UM, we try to reach out as much as possible to all clients, no matter how unresponsive they are. We usually send emails or try to contact maybe the office manager directly if we haven't heard from them, or if they continue to miss meetings, we try to reach out, try to do the best we can on our end. And QuickBase is probably the most frequently used way we contact the clients, that and emailing as well. But we prefer the clients to use QuickBase because it's easier for the ARs, accounts receivable representatives to work through any accounts that they may have or any questions that they may have. And I have a slide here just with a snapshot of what it looks like. To send a request to a client, we're able to either send a request to a client asking for more information on a patient, or the client can send it to us asking us to look into a certain account.
So just to maybe take a step back, so we utilize 2 PM systems, practice management systems. They do have standard reporting, CPM and SPM. The reason we added QuickBase is because there are certain standard ways that we are actually communicating with our clients, and each specialty may need a different reporting the forms and the way that we design them, the need is different. So the only way that we can actually make that efficient is taking this reporting to a next level. The next level is for us is QuickBase, and just want to make sure that that's kind of clear for our people.
Yeah, and we try to definitely reach out to the client to make sure that this is the main way we want to communicate. Like we want to communicate through QuickBase, specifically for patients. And I mean, email is not bad, but it's not the most secure way, obviously. So QuickBase is a lot more secure on that end as well. Switching over a little bit to the end of month. Another helpful tool that we can use to communicate with our clients is the end of month reports. We send this the first day of the following month to all of our clients. And it'll just display a summary of, it'll display basically just a summary of all the information that we have seen within that month. And I just have like on a slide some items that are included, such as the cover page, which is basically a summary of all the findings, denials, client-related or system-related, and also financial information, which the clients are obviously really paying attention to. And I think I have an example for each one. Yes. So first item I wanted to speak about was the cover page. So as I said, this displays a brief breakdown of the client's current status, includes the client name, specialty, and contact. Also, it includes the state of the AR section, which shows how long an average claim takes to get paid, which is our days in AR. And any issues or trends that UM is seeing. We'll also include that in the additional notes at the bottom. And I have like a example of one of the slides.
So one of the reasons for the end of month reporting, the way that we design that is actually going to the practice partners. It's not just going to the practice administrators, because we know that in our small and mid-sized practices, our client is the physicians who own the practices. So we wanted to make sure that when they receive information directly from us, we are not relying on anyone on their side, so that information is being sent to the client directly. So that way, if there are any issues, the only way that we can improve and catch any type of issues is if everyone is looking at it at the same level from different angles. So, and then I think that's important for a client to review their reports carefully, and then those are the reports that we discuss when we have our monthly meetings with them.
Yep, exactly. Yeah, and usually when this report goes out, whenever we have, at least on my end, whenever we have the next meeting, we usually go over the end of month reports and just break it down, try to make it easier to understand sometimes. And like you said, like the next topic I had was the denials reporting on the end of month report. So it'll show the amount of denials that we enter on UM side each month. And these are just insurance related. It can be either I think the majority of the denials are usually client preventable, at least for all my clients. And they are usually separated in categories of check-in and check-out. And I have an example on one of these slides with the client preventable summary, which breaks down basically the amount of denials that we're receiving per month, for a 3-month period, 3-month span. And we can use this report to report to the client on how well their progress has been coming on certain denials. Like for instance, I have an example up where this client has issues with entering incorrect insurance information. So we can go month by month to see how well they're doing in that category. And I think this report, I use this on in every meeting. It's really helpful to see how well the staff is doing and if they're actually paying attention to what we're discussing in our meetings. Let me see here.
So one of the other important part of these reports it actually communicates the days in AR. And then not only they see the days in AR, but we are also sharing the averages with other practices who are in the same specialty, so that they can compare themselves as well as the industry standards too. But again, days in AR is important for medical offices, and then when we are able to point out how to correct these issues, what's the best plan of action, the next step, those are all kind of summarized in one page with the support of all the detailed reports, right?
Yep, correct. And that was actually what I was going to talk about in the next slide. I had the report card, an example of a report card where we share the, like you said, the days in AR, the total charges, the outstanding balances over 90 days, the patient balances. So yeah, it breaks down pretty much the progress that we're seeing month to month. And obviously, this is a helpful report for clients to see how well we're working and also how well they're doing as well, especially with some practices having large patient balances. Like maybe we'll have to make a decision on whether they have to send patients to collections or so it's just a good report overall to just see how well the practice is doing in general.
Yep, absolutely.
Another financial report that we use that's included in the end of month report is the charges and payments, which I think every client wants to review this, at least in my meetings when I'm meeting with clients. And it just displays the total charges from the previous year and this current year. So I have an example of one showing just the total charges, total payments, and total adjustments breakdown by each month, and you can compare it compared to last year. I know that there were a lot of discrepancies when we were comparing certain years because of COVID, obviously. So it wasn't really a good comparison, but this report is helpful, at least within the year, to see how much, like if the client is consistently putting charges in on time, or if we're seeing a decline in payments. It's just a helpful report as well for providers to see. And the last report I had attached to this was also related to charge and payments, but it was broken down by provider. And I know a lot of providers request this report because they just want to see the breakdown of, I guess, the productivity of the physicians that are associated with whatever client. So again, it just breaks down the total charges, payments for each provider. And this is more, I guess, definitely helpful for the, I guess, the main provider for those clients, just to see the production of their staff. But yeah, that was all I had. Well, I don't know if you had anything.
So one thing that we know, we get a lot of good feedbacks from our clients when we standardize reporting and communication, even if everything is not perfect, but being able to openly share everything, being transparent, builds the trust with our clients, and that's why they're happy with us and with our services, and we appreciate them, and I know they appreciate us. And Darren, thank you for joining us. So this was a good presentation, and I'm sure we'll have you in the next couple of months again.
Of course. Thank you for having me.
Thank you.
Bye.
So Sean is coming back, and we are going in some trouble topics, right?
Yes. All right, I'm back. Yep.
So we are going to do the global events first.
Sure. Yeah. So there's plenty on the plate here for our global events this week. We'll be covering a little bit on Russia-Ukraine conflict, how Turkey is involved with their peace talks, what progress we're seeing there. Then we also have an update on China and how they are now performing military exercises with Russia. So we're going to keep an eye on that. And then we're also going to touch a little bit on what's going on in some of our other parts of the world with conflicts going on, unrest, unease. We have some examples in Africa, and then also just a comparison on kind of the ways of life. We're looking at some of the different areas in the world and just comparing those.
I think from the global event side, probably the highlight of the entire week was President Erdogan, the president of Turkey, and people may have different opinions, but what he's able to do in the last several months is pretty outstanding. So being in the same room with Putin, and then next week he's in the same room with Zelensky, and then keeping a distance and then being trusted by two enemies. That's a big accomplishment, but also that tells you a lot about who he is. If these people are able to trust him, and then now things are changing, and I think it's going to be for better. And I do actually admire the work that he has done so far. Again, we may have different opinions, but when it's beyond the country level, when it's the whole the world that we live in, and things that we are doing is impacting others' lives. So I think that's an important credit that we need to give him. Although he still doesn't get enough credit from the Western world. Not sure if we want more trouble or we benefit from what we are doing. But I think now even the Syria is going to be in the peace talk. So then they're going to start conversation with Syria. That's huge.
Yeah, like as you're saying, it's definitely a delicate path that he's going to have to walk. To they're literally at war, and he's meeting with both of them, a week apart. And for someone to take on a challenge like that is just speaking to his character, and also kind of the ideology he might be living by and what goals he's trying to accomplish, not just for him, his country, but also the world. What this Ukraine-Russia conflict, we saw a couple of weeks ago, we mentioned how the grain exports were impacting countries in Africa, and how the starvation, and they weren't getting food because of ports being blocked off. So
it's kind of interesting you mentioned it. So before our event today, after the case conference this morning, so I was actually just going through the news, and so like if you live in Finland, so their highlight today is their prime minister or one of their ministers was dancing in one of the private parties, and then they are criticizing her, and then she's kind of saying, "Oh, I was just having a good time."
Yeah.
And that's what keeps them occupied.
Yeah.
But if you live in Ethiopia, if you live in Sudan, if you live in Congo, it's a different,
really drastic comparison.
So that's, I'm laughing, not laughing because it's funny. It's just like, it's sad in a way that this is how bad the world that we live in. So the person, the human being here versus the human being in Bangladesh, that's not same value. If it's in Tigray, in Ethiopia, it's not same. So for one person, that the criminal basketball player, we just were able to give the entire house, and then there are like 75 people dying in a single, explosion and stuff, and then no one cares. And I think it's the same thing is happening again and again and again. And then when you just see this all the time, and we are so we both are on this side of it, and it's kind of like sad to not be able to make any changes.
Right.
So Now, we have one of the updates, Apple's market valuation
Yeah, so-
exceeds GDP of major countries. So tell us about that.
Yeah, so this actually article is originally back in January of this year. So, 8 months ago is when this threshold was actually passed. But this kind of just piggybacks on what you're saying here, where Apple's GDP is exceeding that of, I believe there's only the US, China, and maybe Germany or something. I'll have to see on the slide that, US, China, and Japan and Germany are the only countries as a whole that have GDP higher than the single company of Apple. So as you're saying, there's countries where, people are starving to death. There's, genocide occurring. There's conflict, civil war, unrest. And then there's companies that are making trillions of dollars. So
those countries, those people who are having those troubles, they all have iPhones, right? So they're trying to get the newest one. There's some irony, and I don't know. I don't know if we're going to find an answer to this, at least in my lifetime. But for being a little bit older than you are, like what we learn is that people are not making any changes. They're not taking any action to change their lives. So they're just expecting from others.
Yeah.
So, and unfortunately, I see this with our patient care. I see this with our business relationships and others. So there's always like receiving, and there's something about receiving and receiving and receiving. But when it comes to giving back, there's not much effort. I see. One of the things that phrase that I like is like having your cake and eat it too. That's just applying to almost everything that we have in the world, and that's I'm not enjoying that much. I can just tell you that much.
Yeah.
Now we can go to the US side of this, so then hopefully we won't get us in trouble. So as I'm just putting this, I was just reading that Biden's is spending about $500,000 for the beach house for the fence, the security system. So, and I think that's actually paid by the government. So
chances are,
right?
Yeah.
Security, right? But we have a new bill that they just passed.
Yes, interesting name that it was passed under. So it's the Inflation Reduction Act. And as we'll see, are you want to touch on what it covers first and then kind of how it relates to the economy? Or
so let's do the Inflation Reduction Act. This is almost like a 750-page bill that they passed. Now, again, you don't want to take any credit from anyone. My good friend Chris Coons actually is, I believe, one of the people who was supporting this bill. But sometimes it can be a little bit too, liberal on these issues. This is not about inflation reduction. So this is even if there is, the fiscal impact is not going to be until like 2030 or 2031. We can actually call this more like a climate bill.
Yep.
So now, just to be fair, covering what it is, so then the goal is to lower the energy cost, the tax credits for electric vehicles, faster tax refunds, cheaper prescription for seniors, and there's basically some other benefits. Maybe they may get into farmers and giving some credits for those. But the reality is, even the model that they took from Penn Wharton budget model, they are saying that this is not going to have any inflation impact.
Yeah,
zero.
And yeah.
So, and it's not an opinion. I mean, we didn't study this. We are actually just reading what's available to us. But if they model this from the Penn Wharton budget model, and if that model is nonpartisan, opinion is saying that no, this is not going to have, then we have to look into what is in it and where we are spending, how we are financing, how we are going to actually finance this. So actually, maybe we can talk about those a little bit.
Yeah, as you're mentioning here too, the fact that it's an interesting name that they went with that is called the Inflation Reduction, but like you're saying, there's nothing that's really going to be impacting inflation at all. Also, the Congressional Budget Office was saying that if there is any impact, like you're saying, it would be years later and it would be 0.1 percentage point higher. So seems to be.
So they believe that it's gonna bring 737 billion, which is gonna cost 437 billion. So the net impact of this is about 300 billion. But where is this money coming from? So, and then where is the money being spent? So that's kind of important. About 222 billion of this is being spent for the energy credits, I believe. So actually 386 billion is for energy and climate. And when they say it's about healthcare and and although I do see that as a good move, but it's not enough. So that's only 98 billion is gonna be with the healthcare related stuff. Now they are planning to hire
which is ironic.
80,000 80,000 IRS agents, right?
Yes, to enforce the taxes that they raised. And says the bill is going to be investing 80 billion for that IRS to be setting out. And
then not only that, but one thing that I want to make sure that the first thing that I should have mentioned, there will be a minimum 15% corporate tax.
Yep.
And then 222 billion of the 737 is coming from that. Okay. So, but then when they are hiring these people, when there are more people in IRS tax force, who are they going to actually target? So the companies, they do have accountants, they work professionally, but then individuals who are in middle class are not protected.
Right.
When we say middle class, this can go anywhere from someone making from 150,000 to maybe 450,000. So they don't have the same support that corporations have. So when you have 80,000 people who have nothing to do, who are they going to go after? They're going to go after these individuals. And that, this is part of the big government anyway. So this is why the government should stay out of certain things and they should not get into everything. The only reason we have inflation is because we make bad decisions in different parts of the world and in this country too. So there's no shortage of oil and then oil prices went up. So just that by itself, and who made the profit is not us, it's the oil companies, maybe some countries too. So why are we creating those situations? So now we are going to try to figure out how to, offset this. With this one offset. So this is definitely one offset. This is only 737 billion. Then if you look at our that calculator that we were checking time to time, we are over 30 trillion already. So then this is a different agenda, in my opinion. Right. It's kind of like it has a hidden agenda. Unfortunately, Biden doesn't give us any good positive things to talk about. So like it sounds like if you keep criticizing him,
what's happening.
His sunglasses are full, but all the other decisions that he's making are not full. So I think it's affecting people. It's affecting businesses. When you go with the corporate tax of minimum 15%, what that means is those corporations. This won't affect. I don't believe this impacts us directly. So I'm not being. I don't have a horse in the race on that. When you tax these people, that maybe if they're not being taxed at that level, now minimum 15%, well, guess what? The production is going to go down.
Yeah.
This is studied so many times. This happens so many times. Why are we just keep trying this?
Right.
Like, there's no reason for that. So now the only positive of this is the prescription cap for elderlies. It's giving some freedom to Medicare to negotiate with the pharmaceutical companies openly, I guess. So hopefully that will come out. But this is truly, I think, I'm kind of happy that these things are being recorded. So then people who are watching and right now they may not agree with us. 3 years from now, you go back and watch it, and then you're going to see that most people who got impacted with this is the middle class. Middle class is who's going to be targeted with this. So whether people believe this or not, that's their problem. But it's so clear. I mean, there's I can't really say much about it. So anything else that we didn't say?
Yeah, and even the potential positives, like you're saying, with that $2,000 cap on the annual out of pocket, that wouldn't even be seen until 2025. So you're not going to get an immediate.
I mean, the idea is good. So I like that being
eventually
on the ticket. But if it's not, affecting people right away, so that's not going to be. It's not going to be helpful. I don't think this is a big event. That's the part that I don't understand. So, like they're saying that this is before the midterm.
Well, you could claim job growth, right? That many more jobs for IRS.
So, again, when I say this, I know that I can only imagine what people are thinking. So they think that, like I personally, if they think that I'm a Trump supporter, I am not. I don't like Trump. Okay, so I'm just saying that. I do, on the Republican side, I do have maybe financial economic values around the more center of the right, and just being open. And on the social issues, I can be very liberal. So between the two, that makes us independent. But let me just tell you one thing: the reason these types of things will not work. You go to last Tuesday and then see what happened to Dick Cheney's daughter, who lost the election against Trump. This is happening in the Republican Party. Why? Because when you are mistreating individuals who are in politics, then it's always backfires. So she's the daughter of the former president, the vice president, and then where she is today, she had the primary. She was the congresswoman for 2 years, and she lost. And big time. It's not like she lost with like a small margins. So she lost almost like 30 points. So why? Because there are people, they know that someone is not being treated right. This doesn't have to be that person is on our side or not. It's a person who should be treated objectively. So the certain things should not be happening in this country. So what makes us unique should stay unique. And then now we are someone who's just for the political gain. We are going after our former presidents, and we have nothing against any of the law enforcement officers. But we also know that when they are there and no one else is there, who knows what happened there? Who knows what they're able to get? When the FBI came to my house in 2012, they didn't ask me. They didn't say that I should get my lawyer. They didn't even remind me. Why? Because they want to get you at least prepared. But the law is supposed to be protecting us, not shouldn't be punitive, right? So this is a punitive, and then what punitive happens when it happens? What happens is you lose. So all these expensive bills are not going to actually save the midterm, and we'll see that in November. This doesn't mean that I'm supporting Trump. This means that this is the reality. Whether you want to hear this or not, that's your problem. Okay, so this topic just increases my blood pressure. Let's not do this anymore.
Well, unfortunately, that's what's happening in the news. That's what we're talking about. We're not choosing. We're telling it how it is. So this is what's happening, and here's the results, consequences that you should expect, and what we are seeing.
Yeah, like one other thing that on the highlights is that credit card debt is the highest all time highest, 930 billion.
Yes.
If that doesn't tell you anything, then you are kind of you are in a denial. So
not good.
930 billion. US we hit all time high. So that means people are borrowing. People are spending money that they don't have.
Yeah, and for those who remember some of our financial topics we talked about in the past, there's a difference from the good debt and the bad debt, and this credit card debt is not a good debt where you're borrowing to make more money. It's going to be a high interest rate on those credit cards, so
if someone is using their credit card and they're just making their minimum payments, they will be spending their principal income.
Yeah, I mean their monthly payment's just going to be paying off.
Sustainable.
Yeah, it'll be just hitting the interest that's already tacked on. So kind of a lose-lose there.
All right, so from one blood pressure topic to the next one is what's happening in Newcastle County with St. Francis Hospital Trauma Services, why this is important. Now, apparently it's not definite yet.
Okay.
So, actually, I had a meeting with the CEO of St. Francis, Chief Medical Officer of St. Francis. Unfortunately, it's not a local person anymore. So St. Francis belongs to this big Catholic organization, the Trinity Health, and then they have remote chief medical officers and chief executive officers, and I don't think St. Francis is getting the they're not getting the attention that they should be getting. And that's a shame. Now, on top of this, apparently closure deal is off. Christiana Hospital was trying to buy closure, and then that's not working. Something to do with their for-profit, non-profit status. So this may bring Christiana to focus on St. Francis, which would be another mistake, because we want St. Francis to be independent, and we want St. Francis to be an alternative for people who needs that access, and also there's a good competition and there's a good balance in the market. So now, when we talk about trauma services, one thing that's important is this is not like the accident that we are talking about. These are 50% of the trauma services are related to one level fall, and one level fall usually involves elderlies. So when we have a patient who's like 72 years old, this patient, actually my mom fell a month ago. So she's 71, and this is, I mean, luckily she didn't, it wasn't too bad, but she ended up going to the hospital, and it can happen at home when they live by themselves or when they are walking from one place to the next. And then it may require services of trauma when all the other hospitals are minimum at level 3. For St. Francis to go from level 3 to level 4 would be a huge mistake. And then also they would lose a lot of business.
Agreed.
So,
I agree.
Now, why we are worried about St. Francis that much is because there is this giant, right? So I think we are going through those on the in the video. Let's talk about that giant a little bit. This giant, it's a nonprofit, right? Go ahead.
Yeah. So as you're mentioning, Christiana, we know that they are filing, which just for everyone, I wasn't even aware, but the tax records are public, so anyone can see this. You can look at the data for yourself. It is factual. It's there. You can access it. But this, they are a nonprofit organization, and based on this 3-year span, which will be displayed in this loop here, over $445 million in net income over that 3-year span.
So this is a nonprofit hospital. The reason tax returns are available because they are not nonprofit. But in 3 years, they made 445 million profit. So
big number.
This is a huge number, right?
Right.
So now this is not a hotel, right? So this is a medical hospital.
Yeah. So you'd wonder where that money is going and how they're using it.
Well, it was in the picture earlier in the video. So the lobbies that you see, they are not Ritz-Carlton. They are not any of the 5-star hotels. They are the hospitals in a smallest, second smallest state in Delaware. I mean, in the United States. I'm sorry, in the United States. So these pictures are coming from just like the hospital campuses. So like, how much money is being spent?
Is that necessary?
For what? And they are still making 445 million in 3 year in the last 3 years that's available to us. And also how much actually other support that they're getting, financial subsidies that they're getting.
You can donate for charitable.
I'm actually more curious about the 2021 fiscal year because that's going to include the full COVID. And I just want to see how much they really receive from the government. So because they didn't need it. So
Obviously
they're
not.
overcharging.
Unless they want to get another atrium. We
So
don't know.
we talk about the drug prices, and you may remember, and I do have the printouts here. There is a diabetes drug that's given by the endocrinologist, and it's about $7,000. And I saw bills because patients, they are the primary care patient, went to the endo, and then they are trying to see if we can help them with the bill that they receive because they think that there's a mistake. Christiana Hospital charged like the almost entire amount, and then keep in mind that 20% is the patient responsibility if they don't have secondary. That's several thousands of dollars for those patients. It's not it's not easy to afford those. But this giant is now probably go after St. Francis, and when Christiana is able to do what they are doing, of course, St. Francis is not, but they are also at fault, right? So because they don't have the leadership, they didn't appreciate certain relationships that they had, which we talked about this last week. I built them with Dr. Erkan a program that actually brought 12 additional surgeons. These surgeons did not have credentials in St. Francis. And we can go back and look at the 2013 numbers. And then a couple of years after that, we bring these surgeons who are already well-established surgeons. We actually ask them to complete their trauma certification. It's called ATLS. And we did all that work. And then this relationship was not appreciated. And then today, now they're at the point where they're going back. That's just kind of sad, but at the same time, we know that even this is their fault, we still need to help them to get out of this trouble. And then we'll make sure that from United Medical ACO and from the personal means that we are going to support St. Matt's Hospital. Yeah. And then if there are any new updates, I will keep you guys posted with that.
Keep that updated. But yeah, as you mentioned, just regardless of what field, healthcare just is obviously what we're focusing on here, but having monopolies is not ever good for the consumer, or and our smaller ones kind of just get pushed out of the way, and unfortunately once one kind of takes over and monopolizes, it's a little too late. So want to prevent that.
We don't want monopoly. We want alternatives. We want competition, healthy competition. So then we can we can maybe talk about this a little bit more later on, but what Christiana Hospital has done in terms of dominating the market, and we suffered from this for a long time before we were recognized as a Medicare ACO. They still come after us, like wherever they can actually. And then I know that this is not the right way to do the business in healthcare. So private practices are more efficient, inexpensive, and the outcome in some cases even better. And we do this better than the hospitals because outpatient is not the hospital work. It's not their core business. So this is our core business. So therefore, we're not going to just give up, but then government needs to actually watch out to help us to understand or help everyone to kind of be fair when they're being paid more for the same service. So there was a new article came out with the surgery center in the healthcare finance magazine. We can actually post that later on. The surgery that costs $2,000 in a private surgery center, gallbladder surgery, is $12,000 in any local hospitals. That's 6 times more. So that's why these things are important for us, and then we want to make sure that there's at least some competition out there.
Definitely.
All right, so I'm going to go and take my blood pressure pills and just cool down before the Bariatric Friday. And luckily, I have Dr. Erkan who's going to talk to us about the patient with morbid obesity. That's going to be happening in 10 minutes. Well, thank you for listening to us, and thank you for joining us. Sean, thank you for being here.
Yeah.
We'll be back next week.